Hi, my name is Dr. Fred Southard, and I'm a doctor of chiropractic with an office at 860 Northwest Washington Boulevard in Hamilton, Ohio. I'm a graduate of the Los Angeles College of Chiropractic, and I've been practicing chiropractic in Hamilton, Ohio since 1978. Thank you for visiting my site and welcome to our office. In our office, we treat the normal chiropractic problems of headaches, neck pain, upper back pain, lower back pain radiating out to the shoulder and down into the arms, and pain radiating into the hips and down into the legs and sometimes into the feet. We use a very gentle, non-traumatic adjusting method called the activator technique in our office, and we use this little instrument right here to perform the actual chiropractic manipulations. As you can see, when I put this against me, if it were painful, I would not be doing this to myself. And the way we do adjustments is we put this little instrument right over the affected vertebra that needs to be realigned, and just a little tap, 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 and it goes right back into position. And there's no snap, crackle, pop. There's nothing traumatic about the way we adjust in this office. In addition to the chiropractic adjustments, we also use physical therapy modalities in our office, such as heat and ice. We use ultrasound, and we use electromuscle stimulation, and we use these modalities as a means of reducing inflammation, getting rid of some of the muscle spasm, and taking the irritation out of the soft tissues. In addition to our regular chiropractic work, we have a number of patients who take advantage of our detoxification machine that we have in our office as a means of trying to improve their health and achieve better health. In our office, we specialize in the treatment of herniated and bulging discs, degenerated discs, sciatica, and lumbar spine stenosis. For the specialty part of our treatment, we use a very specific technology that was developed by Axiom Worldwide Incorporated. And you may have seen it advertised on television. This is a machine right here. The specific technology to which I refer is known as spinal decompression. And as I said, we use the Rolls-Royce of spinal decompression equipment, the Axiom DRX 9000. What happens with this is someone sends this little platform right here, and all we do is we just tilt them, they lean back in the machine, and we just tilt them very gently right on down to where they're laying on their back. And once we get them all the way down, we have harnesses that we attach to the machine and to the patient, and we start the decompression process. It's very gentle, it's very non-traumatic. In fact, most of our people who have decompression actually, a large number of them anyway, go to sleep while they're on the decompression machine. It's not uncommon for someone who has had spinal decompression to come back after they finished it, and they tell me that they have been given their lives back as a result of the treatment. People who were not able to walk distances for exercise are now able to walk greater distance, a couple miles a day. An 87-year-old man who went through care in our office with the spinal decompression. One lady, actually two ladies, they had to get up an hour and a half early in the morning because their spine was so degenerated that it took them that long to get ready, get mobile enough to where they could go to work. And after the machine, they bounce right out of bed, go in and get dressed, and they can get right on to work, and they don't have to get up 2 hours in advance just in order to get ready to go to work. The effectiveness of the machine is demonstrated in a non-randomized pilot study that was authored by Dr. John Leslie, a medical doctor who's associated with the Mayo Clinic. And the study was designed to evaluate the safety and the effectiveness of the DRX 9000 spinal decompression on chronic lower back problems. And he and his colleagues found an amazing greater than 50% reduction in pain score was observed after just 2 weeks of treatment with the DRX 9000. After completion of the entire 6-week protocol, I want you to listen carefully to this, an amazing success rate of 88.9% was documented by Dr. Leslie in his study. The entire data from this study has been presented at the 2008 American Academy of Physical Medicine and Rehabilitation that was held in San Diego, California. To receive a complimentary report about spinal decompression, I invite you to visit my website at www.southardspinalcare.com. That is www.southardspinalcare.com. In addition, I ask that you pass this information along to a loved one, to a relative, to a friend, or just to someone you know who suffers from chronic lower back pain and/or sciatica or pain radiating into the legs. Additionally, we can be reached by calling us at 513-868-0978. Again, I would like to thank you for visiting our site and watching our video. We hope to hear from you soon. Goodbye.